Taveen Kirkpatrick has worked as a nurse with Keck Hospital of USC for 14 years, but today, she's not on the hospital floor. She's outside, on strike because of what she calls dangerous hospital policies.
We're here to say enough's enough.
Nurses at Keck have been in negotiation with the hospital since November 2020. Kirkpatrick says the main things they're fighting for are proper staffing and adequate rest periods.
The reason we're not able to hold on to our staff is because our nurses are burned out and we need a stronger contract. We need a contract that retains nurses and keeps our patients safe.
As a surgical nurse, Kirkpatrick works in the recovery room and is often asked to work 20 hours for an on-call shift. The union is asking for a longer rest period to accommodate commute time and give nurses enough time to care for themselves after caring all day for patients. Kirkpatrick says it all boils down to patient safety.
We're asking for a 10-hour rest period so we have that, hour window commute that many people have to drive home an hour, sleep, eat, shower, and then come back.
The chief medical officer says the hospital is ready to get back to the negotiating table, but she says the staff and working conditions at Keck are better than any hospital she's ever worked at.
Keck Medical Center is one of the safest institutions. I think that's well established based on our excellent outcomes and the rankings. Keck Hospital has consistently received an A grade for 4 cycles. And staffing also has been looked at many times by the California Department of Public Health, and consistently every review has identified that Keck Hospital actually exceeds staffing ratio. We can get back to the table and resolve whatever it is that they have concerns about. And we want to welcome our nurses back. Our nurses are the greatest nurses in the state.
A registry nurse just can't take my space. They don't have the training I have, they don't have the knowledge I have, they don't have the skills that I have, and it's not just me. A lot of these nurses here have been here for a while. It's a highly specialized hospital. It's going to take 2 or 3 nurses just to cover one of us. We know what patients need, and USC is not listening to us. We just feel very undervalued, very unseen.
The hospital hired temporary staff to replace striking nurses. They began work yesterday and are scheduled through Sunday. Negotiations are said to resume on that day, but if staffing issues are not addressed, nurses say they're prepared to strike again. For Annenberg Media News, I'm Cambry Guest in Los Angeles.